Good afternoon. My name is Brian Howard. I am the town manager for the town of Randolph. If you've been following our Facebook feeds, our social media feeds, our email news blasts, you've been getting updates regularly on COVID-19, the coronavirus. As we've stated all along, the situation is fluid. We've had a number of situations that we are addressing and making decisions today that will impact families and residents of the community. So I thought it was important that we get together our public health, our public safety, our senior affairs, and our superintendent of schools together to talk about those decisions. Out of an abundance of caution and to try and slow the increase, it's important to note that at this time, Randolph does not have any cases of coronavirus in the town of Randolph. The Randolph Public Schools will be closed for 2 weeks. The community center and the library will also be closed for the next 2 weeks. Our emergency management team has been in place since the coronavirus epidemic has begun. We've been meeting multiple times a day, often dealing with state and federal agencies in conference calls, including one that just ended. Town Hall will remain open at this time, but we do ask that you work with us. We know that a lot of our critical town services need to continue. If there's any services you can do and do online, we ask that you do. So if you're able to pay your bill online, such as your real estate tax, excise tax, utility bill, please do so. Also, we have a drop box out front, and we're asking residents to limit the use of cash if possible and use checks if they're coming to the town hall. We know that is not possible for everyone, but if you're able to assist us, that would be great. In addition, if you do exhibit any cold or flu-like symptoms, we do ask that you stay home. Our Director of Public Health was going to go much more specific into the health issues that we're confronting and what we're going to be asking you to do. At this time, I would like to turn it over to our Superintendent of Schools. She will update the residents as far as the decisions involving the public school system and where things will stand for the next 2 weeks. Superintendent.
Thank you, Mr. Howard. Good afternoon, everyone. It is unfortunate that we are here, but we definitely, the administrative team, the leadership at Randolph Public Schools did not enter into this decision lightly. We have worked with the town officials, we've worked with state officials to make sure that we are providing the utmost care and safety for our students as well as our staff. I want to just give a couple of quick bullets. There was information that went out to you today. Our school is closed from Monday, the March 16th through March 27th. We are expecting to return to school on March 30th, and we'll be closely monitoring what is happening with COVID-19 in our district as well as in our state. We are asking families to frequently check our website. Practice social distancing. They're talking six feet apart, 15 minutes of contact, follow proper disease prevention measures, and really this is not a vacation for students. So we don't want it to be seen as this is a time where students are hanging out, congregating in long crowds. What we're really trying to do is avoid the spread and peak of COVID-19. So parents, we really look forward to your help in making sure that our students are doing just that. We will be providing meals to families in need, to the students and children of Randolph. We are hoping to start this service on Tuesday. We are simply waiting for approval from the Department of Elementary and Secondary Education to do so. I will be issuing a statement on Monday, sometime in the afternoon, as to where the drop-off locations will be and where the pickup locations will be and the times that are available. So we are hoping that that will start on Tuesday with breakfast and lunch for the children of Randolph. Medication. I know that with schools closing as abruptly as they did, that there are parents whose children have medication that is housed at our buildings during the week. If you are a parent who has medication at one of our schools, I am asking that you call the school on Monday and make arrangements with the administrators there to pick up your child's medication. We are also working with the Y right now. So the Y is offering, for a fee, limited day programming from 8 to 4 for all the current school-age children who do not have access to alternative care. These are kids that they are currently serving who they would service at their Stoughton site. We are, Randolph Public Schools, we are exploring the possible options of transporting students from the local schools to the Stoughton Y campus. But if you are interested in that, we are asking families to call the Y directly at 781-341-2016, extension 244, and they can give you any further information that you need. Lastly, I just want to say that I will be sending out regular communication. If you have not done so already, please download the RPS mobile app. It will give you the fastest, most up-to-date information that is coming out of Randolph Public Schools. Right now, I'm advising you all to just stay healthy and stay safe. Thank you.
Thank you. We do have, to some extent, I'm trying to monitor the Facebook Live feed and answer any questions. One point that was just made is that this is a pickup lunch program.
Yes, it is a pickup lunch program. So we are waiting for approval to determine what kind of program it's going to be. We are not housing families to sit and eat as we normally do in the summer, but it's very similar in the sense that we are looking to provide boxed meals for families for breakfast and lunch, so they would pick them up and go. And once we name the sites, one of them will there'll definitely be some of our schools, but we also want to try to find a town facility as well. So we're waiting to see what the state approves. We will list the sites, time of pickup, and what the process will be to get that.
Thank you. One of the things we've tried to do is hold off as long as we could in having to make any closures on town property. As I mentioned earlier, the town hall will be opened. However, as an abundance of caution, the community center and the library, the governor today has stated that in large settings, up to 250 can be in an area. A lot of the spaces in both the library and the community center are much smaller than that. We're going to hear a little bit more from Commissioner of Health, Jerry Cody, in that sense. But we thought it was very, very important that we had to, at this point, make the decision to close the RICC and the library. It's very important to note that we are not going to stop providing services to our seniors and those in need. At this time, I will ask our public director of the library, recreation, and community programming, Liz LaRossi, to give a further update.
So the library and RICC will be closed to the public beginning tomorrow through March 27th or until further notice for both facilities and programming. Staff will be on site to field calls, emails, and online chat Monday through Friday during those weeks, 8:30 a.m. to 4:30 p.m. In regards to the library, all checked out materials will have their due dates automatically extended. Digital access to resources such as Hoopla and Canopy has been increased. If you need help remotely accessing things, you can call us and we can try to talk you through things over the phone for technology help. Librarians are currently working on virtual programming such as story times. Our YouTube can be accessed at turnerfreelibrary.org. In regards to the RICC, we will be serving as the central site for fielding calls concerning seniors and those with mobility issues and their needs. Meals on Wheels is still operational at this time. All current memberships will be extended during this time. Transportation for seniors will continue, but will be limited to grocery store and medical rides. Please check our websites and social media or call between 8:30 and 4:30 Monday through Friday for updates. Depending on how the situation goes and how it unfolds, we will also be putting out a call for volunteers if necessary down the line. Thank you.
Thank you, Liz. I can't say enough about the work of our Public Health Department over the last few weeks, really day in, day out. They do an excellent job in continuing to protect the residents of this community. At this time, I would like to have our Director of Public Health, Gerard Cody, to address some specifics in regard to the coronavirus, things to consider. You've had a very busy few weeks.
Yes.
I know both myself and the superintendent mentioned earlier this morning in our team meeting, their gratitude for the work you and your staff is doing, and I certainly want to mention that again. Jerry,
Very
if you'd
good.
like to give an update.
Yes, my name is Gerard Cody. I'm the Public Health Director for the town of Randolph, and I'd like to let you know that even though we do say that there's no coronavirus in Randolph, we know that it's in the area, and we want to make sure we're following all the precautions. We don't want you to let your guard down. Obviously, we're closing the schools, and the closing of the school, it's a public health response to a serious and rapidly evolving infectious disease. The intent of that is to slow the transmission of the disease. And this is a proactive and preventative measure to help keep our community functional and healthy. So we're in a pandemic situation, and that's a worldwide event, and this is new territory for us. So we want to take personal precautions, and we've heard this hundreds of times. Wash your hands, cover your cough, stay home if you're sick. These are all real preventative measures you can take now so that you don't become sick. And when we say wash your hands, we really mean 20 seconds with good amount of soap, water, and really want to good lather that up. And you want to make a cup with your hands so that the water will fill that and it'll rinse out. Why is that important? Well, we have the virus can live outside of the human body on surfaces. So if we touch a surface that may have had the virus, it could be a door handle, could be a handrail, could be a mouse on your computer at home. You do not want to touch your eyes, do not want to touch your nose or your mouth. Those are entry points for the virus to get into your body and cause an infection. So that's why it's really important, why we always emphasize good hand washing. We also want to emphasize cleaning of surfaces. And most of your common household cleaners, different brands, I'm not going to name any brands, but we know that they are very effective on wiping away the virus from surfaces. There is a list of approved products that you can find on the cdc.gov website, also on the mass.gov website, and you'll look for the banner that says COVID-19. Now, there's a lot of talk about social distancing, and we're probably not showing a good example of that together. As we said, that social distancing should really be a 6-foot barrier between each other. That's in a public place to help prevent the spread. So we call it close contact is when you encounter a person with a known infection of COVID-19 and you're within 6 feet of a person for a period of time. Typically, the period of time it would take maybe about 10 minutes, like a typical conversation where there could be virus spread from person to person. So we want to think about that when we're out and about in public, but for the most part, we really want to practice our personal prevention to stay healthy. If you do feel as though you've become sick, it's important to know that it comes with a fever, it comes with a cough, and a shortness of breath. It's really the upper respiratory system of your body that gets impacted from the COVID-19 virus. That's what it It wants to get into your body to reproduce and to, that's its goal. So we really want to monitor those prevention measures. And if you do have the fever, cough, shortness of breath, that is something that you would want to call your primary care physician. You do not want to go into a situation where you're going directly to the hospital or directly to your primary care physician if you feel as though you have those symptoms. You want to call ahead, make sure that the facility that you're going to knows that you feel as though you may have COVID-19. You could also call, there's a number from the Massachusetts Department of Public Health. It's the epidemiologist. The number is 617-983-6800. And there you'll get a chance to speak to an epidemiologist. You'll leave a name, phone number, and a message, and they'll call back within a period of time. But you should always call your primary care physician or the emergency room if you feel as though you would like to go and see a doctor. So if there are any other concerns about being at home with somebody that's sick. So we have two different terms that we're using lately. One is quarantine and the other one is isolation that you may hear about. So isolation is used as a term for somebody who is a confirmed case, who that we know has COVID-19. So they would need to be isolated, meaning that if you're at home with somebody, they are truly isolated. They're in a separate room. You could leave food outside of their bedroom and things like that. But for quarantine is a term for somebody that is a suspect case. It's not yet confirmed. They may have been a close contact. They may have come in contact with somebody with COVID-19. So these are terms that we use to help prevent the spread of disease. And in Randolph, the Public Health Department participates in a program called MAVEN. It's the Massachusetts Virtual Epidemiology Network. And what that is, it's a program where we would be notified directly from a hospital, from a lab, or from the Mass Department of Public Health about a case that may be confirmed to be COVID-19. And with that information, the Public Health Department would be able to trace back any close contacts of that person to make sure that the disease does not spread in our community any further. And that's when we would implement either the quarantine or isolation ruling. So we spoke about the preventative measures. I can't emphasize that enough. You want to cover your cough, wash your hands often, and stay home if you're sick.
One of the things we heard today on the last conference call is they are gaining access to more test kits, and in addition, they will be able to do the testing not just at the Department of Public Health office, but they'll be able to, through certain hospitals and with some private companies, be able to also do testing. But this gets back to the main key point. If you feel that you have those three components, in particular the issues with the respiratory, the issue with the temperature, and the issue with the shortness of breath, it's very important that you call your primary care physician and that you reach out to the emergency room before you go. I mean, that is the big thing we've been hearing today.
Absolutely. You don't want to contaminate anybody else unnecessarily. So you always call ahead, and even if you would call into dispatch if you felt as though, and I'll let Chief speak more about that, but if you do feel as though you need to call into dispatch or emergency, always let them know that you feel as though you may be impacted by COVID-19, especially if you're a confirmed case and you know that. But yeah, as far as testing is concerned, we are not able to test at the Randolph Health Department. It's not something any local health department would do. It's through your primary care physician who would order the test and they would also use laboratories, not only the state lab, but there are private laboratories that are now getting involved, and we'll see more and more testing over the next few weeks.
Thank you, Jerry. We were asked a question online as far as reaching out to folks who don't use social media. We will be putting out an emergency call on our network today because we do have some information such as the closing of the school. Senior services will continue even though the RICC, and we do have a number of multilingual information available at the town hall, but also on some of our buildings. We're placing them on the front of the entrances. Public safety, always in time of need. They are critical to our operation. It's important, as Jerry Cody mentioned, that we need you to communicate with us if you're calling for services and you believe you have any symptoms. At this time, I'm going to have our Fire Chief, Rich Donovan, address ways that you can work with our fire department during this time.
Thank you, Brian. Good afternoon. As we are the emergency medical transport agency for the town, we are taking this pandemic threat extremely seriously with regard to the safety and the health of not only the people in the community, but also our public safety personnel. During which time we will be, as calls for medical assistance coming in, we will be triaging and assessing the calls for possible coronavirus-related symptoms. All of our firefighters, men and women, have been given instructions and protocols as it relates to the treatment, assessment, and transport of possibly infected or infected patients in accordance with the CDC measures and OEMS protocols. Our firefighter personnel have been given access to proper personnel protective equipment, eyes, their proper masks, and suits which they can wear when they're doing transports. We also have many partners that we've formed with various state agencies, namely the Office of Emergency Medical Services, the Mass Emergency Management Agency, and the Department of Fire Services. These are agencies we can reach out to if we need further assistance that we don't have the capabilities in the town of Randolph to handle. So with that, I'll turn it back to Mr. Howard.
Thank you, Chief. Now I would like to have our Police Chief, William Pace, address how the public can best work with the police department around these issues that we are currently confronting. Chief.
Thank you, Mr. Howard. Good evening. I just want to report that the Randolph Police Department is open for business as usual, and all services, as you have come to expect, are currently operating. In the next few days, you may see some reductions in service around administrative functions like firearms licensing, peddler's license, fingerprinting, minor accident calls, or public records requests. And that's because this afternoon I restricted all access to the police building in an effort to keep our police employees safe from the virus, and so that they will be able to service the community. So the police station is open, but access to the public is the lobby only. So during this time, some administrative functions will be rescheduled. We would ask that the public please do not call the Randolph Police Department about things like school closures or information that you can easily find on the internet. The superintendent has said that the schools are closed to March 27th, and that is the date. So any inquiries about the school closings should go to the school department. We have a plan in place within the police department should problems arise where officers assigned to administrative functions could be placed back into patrol. This would be one of the last resort measures. We are looking at a change of shift design if necessary, and we also have mutual aid agreements in place should we need them. One other thing I would ask, a lot of our residents like to support the police department. They may bring up food or coffee at times, and it's very nice of them, and we appreciate that very much. But during the next several weeks, I'm asking the public not to do that. As I said, the police station is restricted to the lobby only for the public.
Thank you, Chief. As I've mentioned a few times, and I cannot stress enough, if you're watching this live on RCTV or our Facebook feed, please go to the town's website right now, www.townofrandolph.com, and sign up for our Code Red HyperReach system. HyperReach, and there'll be a message going out later today about the closing of the Randolph Public Schools and the library and the community center. Please go on right now and sign up so that we have the ability to send a text and send you an email and/or a phone call. This information will also be on the town's website and social media platforms at all times, and also Randolph Community Television. This is a very fluid situation. That's a word that we've heard consistently over the past week. Things change daily and in some cases hourly. So it's important that we have the ability to reach out to you and that you check in every so often on the town website and on our social media. Somebody asked about trash and recycling. That is continuing. There's no change to our service with trash and recycling. Also, it's very important, we mentioned earlier, that we are providing, even though the RICC will be closed, we are going to be continuing to provide our seniors many services, and that we've provided the contact information for them to be able to reach out to us. But please check with your neighbors. Kindness goes a long way during times like this. You have folks who, in various methods, have situations where they could be a senior, they could have medical issues. If there's anything that can be done to assist your neighbors during this time, we certainly would appreciate that. Finally, I do want to thank all of the town employees. This has been a very difficult few weeks. I know that both myself and the superintendent have had to lean on our staff, and they have really risen to the occasion. We are very lucky to have folks who care about the people that live in this community. I also want to thank those that are around the table here right now, in the sense that they are our key emergency management team. These are the folks who get my calls, emails, and texts at all hours of the day, depending on what kind of a question that I may have or situations that I become aware of and need to reach out to them. So I do want to thank them. We're very lucky. Our emergency management team works regularly throughout the year due to the efforts of our fire department and our public health department. So our ability to work with each other and communicate effectively is something that we work on regularly. And it is something that, watching it come together over the past few weeks, really makes me proud as the town manager. I want to thank the residents for continuing to work with us, knowing that because it's fluid, we may not have an answer right away, but we will always do everything that we can to get an answer. Our boards, committees, and commissions, we are asking that if they do not have items that must be voted, there are certain things that they have to vote. There are certain things that we are under timeframes, and unless the governor relaxes those timeframes, we do have to have certain boards, committees, and commissions meet, in particular, potentially the town council, the zoning board of appeals, the planning board, and the conservation commission. But we are asking the other boards, committees, and commissions, unless it is something that they have to meet for, that they do hold off at this time. Again, please, what you're seeing right now, we're going to update daily on the website and on social media and on the phone calls. This video will probably do another update each week, especially as after this 2-week period, as you heard, the schools and the RICC and the library, we may be extending that time frame in 2 weeks. At this point, we don't know, but please continue to stay on top of the situation, and we thank everybody for working with us. If we can ever be of service, please let us know. And the town's website, one last time, www.townofrandolph.com. Thank you.